Good morning. This is Dr. Bisi Ademoyewa. This is the fourth in my series of cancer videos, really with a view to educate the lay public. I have a very special guest here with me today. She's a very good friend. She's an expert in hematology and oncology, and she works in a large private institution in the Texas area. Her name is Dr. Monica Desai. Welcome, Monica.
Thank you, Bisi.
Okay. So again, these videos, none of these videos is designed to replace the physician-patient relationship. So if you have been diagnosed with cancer or you have a concern of a cancer diagnosis, please do seek medical advice and attention. So I'll get started right away. So Monica, why do you think cancer is becoming more prevalent in the world, in the US, in developing countries, really just anywhere in the world? We're hearing more and more people are being diagnosed with cancers, and they ask what's going on.
So I think that one of the leading reasons why cancer is increasing is actually due to an aging population. We know that as one advances in age, additional things which are both avoidable and unavoidable are acquired, increasing one's risk toward the development of various cancers.
Okay.
Things that we can do something about include actually maintaining a healthy body weight. So obesity is another reason why I think cancers are increasing.
And that's a big one because obesity has been getting worse really worldwide.
Exactly. And so things that we can do to decrease that risk are obviously maintaining a healthy body weight through diet and exercise. Last, I think that another reason why cancer is becoming more prevalent is just due to different exposures in the environment and other risk factors as such.
Okay. And are there certain cancers that are preventable?
So two that come to mind are lung cancer and cervical cancer. 90% of lung cancers are actually smoking associated. So if we can work on decreasing smoking in our community, in our world, that would decrease the incidence of lung cancer.
And in fact, lung cancer is one of the most deadly cancers.
It is.
So decreasing the risk of developing lung cancer in the first place will really decrease the burden of cancer globally, I think.
Absolutely, absolutely. Second is actually cervical cancer, where with the development of the HPV vaccine, that in and itself decreases the incidence of cervical cancer.
Now, for people who are not in the United States and who don't have access to the HPV vaccine, I think certain strategies to decrease the risk of cervical cancer, because it's, a large proportion of cervical cancer is sexually transmitted,
Yes.
is using protection, so condoms with sex and avoiding sexually transmitted diseases.
Absolutely, that's exactly right.
Right. So which cancers can we detect early? And we know that if you detect cancer early, it's more curable. Which ones come to mind?
Breast actually is one of the most common cancers in women that can be detected early with mammograms.
Okay.
There are great guidelines on cancer screening, and the general recommendation based on all guidelines is starting at the age of 40, women should begin annual mammograms. Obviously, if you have a family history or some other increased risk factor toward the development of breast cancer, you should let your primary care physician know so that they can recommend perhaps different screening for you at an earlier age. Otherwise, in general, starting at the age of 40.
One other thing which I also emphasize, particularly in people who are from low resource environments, so in places where they may not necessarily have access to mammograms, is just simple breast self-awareness.
Yes.
So, there has been sort of a change in terminology. The American Cancer Society is no more recommending breast self-examination, but as a woman, you should still know what your breasts feel like and look at them, just feel around, once a month, so that if there's a change, then you can bring this to medical attention. So I think, even though breast self-examination hasn't been shown to reduce the deaths from breast cancer, it certainly picks up some breast cancers, and the earlier you pick it up, the more curable it is.
I think that's a great point. So just self-awareness
Right.
of knowing if there's a change, then you bring it to medical attention.
Right.
So we talked about breast cancer. Colon cancer actually is another cancer that, if detected early, is very curable. General recommendations based on numerous organizations is starting at the age of 50. Again, if you have a family history of colon cancer, then you should let your primary care physician know, or any physician know, to perhaps start screening earlier. In general, if a family member is detected at age 55, then one would recommend that you start screening 10 years earlier than their diagnosis, or for example at the age of 45.
Right, right.
And then the last cancer that comes to mind that, if detected early, can be intervened upon is actually relatively new in terms of recommendations with regard to lung cancer.
Right.
And there's been a great study that's been published in the past couple of years that recommends that for people who continue to smoke, you should get an annual CAT scan starting at the age of 55. So there are specifics with regard to how much smoking history you do actually have, but I think that it is the best situation to let your doctor know if you continue to smoke, to see if you would qualify for lung cancer screening. Taking a step back, obviously quitting smoking
is the best case scenario.
is
Absolutely.
the best case scenario. And even actually talking it over with your doctor about what can I do to quit smoking, even if you're not interested.
Right.
It goes a long way just to start that discussion. So best case scenario is to quit smoking. While you're working on quitting smoking, there are guidelines on how to follow you to detect an early lung cancer.
Absolutely. And one very important thing is that what we've seen is that the risk of smoking decreases dramatically once you quit smoking.
Yes.
So it's really never too late to quit.
Exactly.
And then the last question I have is, what tests can people do to detect cancers, and when should they do them? Because people, there's a lack of information.
We kind of touched upon this, but just to summarize, for breast cancer, mammograms starting at the age of 40. For colon cancers, colonoscopies starting at the age of 50. Those two cancers, obviously, it's variable depending on if you have a family history.
Right.
And then last, lung cancer with annual CAT scans. We didn't touch on this, but for prostate cancer, there's a blood test one can do called a PSA. And cervical cancer, one would recommend a Pap smear once becoming sexually active.
Excellent. Well, thank you so much. This has been wonderful.
Yeah.
And we will hopefully be in touch, and we will do another video soon on another topic. Again, thank you so much for listening. This is Dr. Bisi Ademuyiwa, just talking about cancers in general. Thank you.